Much of North America is dealing with a harsh winter right now, and many regions are expecting heavy snow and ice this weekend. And every time this happens, orthopedic surgeons know what's coming next. Fractures. Every winter I see the same story. Someone was just taking the trash out, just walking the dog, just heading to work, and suddenly they're in the emergency room with a fracture that changes their whole year. I practice in the Mid-South, and one thing I notice is that people here often aren't used to ice. They don't always know how to walk on it, how to slow down, or how dangerous it really is. And the most dangerous is the kind you don't even see. It looks wet, it looks harmless, and then suddenly your feet are gone, out from under you. People rush, they slip, and when they fall hard. Let's start with hip fractures, because these are the most serious injuries we see after winter falls. In the United States alone, there are roughly 350,000 hip fractures every year, mostly in adults over the age of 65. Now, these injuries are life-changing. About 1 in 3 patients will die within 1 year of a hip fracture, and many of those patients who survive never regain their prior level of independence. Here's something that surprises a lot of people. Most patients don't die from the hip fracture itself, and they usually don't die from the surgery either. They die from what happens after. A hip fracture often starts a cascade of events. Patients suddenly lose mobility, they're in bed, they're not moving, and when people stop moving, bad things happen fast. They're at higher risk for blood clots, which can travel to the lungs and cause pulmonary embolism. They're at a higher risk for pneumonia because they're not taking deep breaths or clearing out their secretions. They're also at a risk for delirium, deconditioning, and rapid muscle loss. Older adults can lose a shocking amount of muscle in just a few days of bed rest. Once that happens, it becomes harder to get up, harder to walk, harder to recover independence. Many patients never fully regain their mobility, and that often leads to loss of independence, placement in a nursing facility, depression, and a downward spiral in overall health. And that's why hip fractures carry such a high 1-year mortality rate. If you're watching this and thinking, that won't happen to me, I promise you, every patient I treat thought the same thing. One very common type of hip fracture is the intertrochanteric hip fracture. We call it the IT fracture. Almost all IT hip fractures require surgery. The most common operation is an intramedullary nail. This is a metal rod that we place inside the bone to stabilize the fracture and allow early walking. Many patients are able to get up out of bed and even walk the very next day after surgery. This is still a major surgery. It's often done urgently, usually within 24 to 48 hours, because delays are associated with higher complication rates and higher mortality. The good news is that when we treat these injuries quickly and get people moving early, many patients do very well. I've seen people in their 70s and 80s work hard in therapy and get back to living full, independent lives. Prevention is ideal, but resilience matters too. As a shoulder surgeon, another fracture I see all the time after snow and ice is the proximal humerus fracture, which is a break at the top part of the arm bone, the humerus, near the shoulder joint. Now, these fractures make up about 5 to 6% of all fractures and are among the most common fractures in older adults. About 80% of proximal humerus fractures are treated without surgery, but that doesn't mean they're minor injuries. Even when they heal without an operation, they can lead to long-term pain, stiffness, weakness, and loss of shoulder function. When surgery is needed, we may perform an open reduction and internal fixation, or ORIF for short. And that means we realign the broken bone and stabilize it using plates and screws. In more severe fractures, especially in older patients with poor bone quality, the best option may actually be a reverse shoulder replacement. In these cases, the bone is often broken into too many pieces and the chances of reliable healing are quite low. Replacing the joint gives the best chance at restoring function and reducing pain quickly. These are not small surgeries. Recovery takes months, and sometimes shoulder function is never completely the same afterwards. Wrist fractures are another extremely common injury in snow and ice, especially the distal radius fracture at the end of the wrist. These are one of the most common fractures from falls because people instinctively reach out to catch themselves. Some wrist fractures heal in a cast, but many require surgery with plate and screws also. The reality is that most of these injuries don't happen doing anything extreme. They happen just walking to the mailbox, stepping off a curb, rushing because it's cold. Ice does not care how tough you are or how busy you are or how late you're running. The good news is that many of these fractures are preventable. Strength training matters. Strong legs and hips help you recover balance instead of collapsing. Strength training also increases bone density, and people of all ages benefit from it, not just older adults. Balance and proprioception matter too. Single leg work, stability training, and coordination drills reduce fall risk and help your body react when you slip instead of having a panic. Your nutrition also plays a huge role in helping prevent fractures. Adequate protein supports muscle health. Vitamin D and calcium help maintain bone strength, especially during the winter months when sunlight exposure is lower. Footwear and behavior matter too. Traction helps, but slowing down helps more than anything. Before you walk outside on ice, do 3 things. Look down, slow down, and just assume it's slippery, even if it doesn't look like it. Snow and ice don't have to turn into surgery. Prepare your body, respect the conditions, and when it's icy, slow down. Nothing is worth a fracture.